Hopefully, you'll find this talk helpful and sort of give you my perspective. The task I was given is to give some tips and tricks, some practical sense of how to approach not so much the colonoscopy technique, but about resection and polyp detection, and what some of the advanced techniques for larger polyps, the resection of those would be. So we'll touch briefly on colon cancer epidemiology, just to put it into perspective, what the best practices are, what are the quality benchmarks. Everything in colonoscopy is being driven by quality, at least in the world we live in, and what are the sort of accepted standard strategies for polyps depending on the size, and how to approach these in your practice. So overall, colorectal cancer incidence is decreasing, but what's alarming is that there's an increasing incidence of colon cancer in younger patients, so less than 55, and especially distal colon cancers, rectal cancers in young folks are very disturbing to see, and they happen before the age 50 when we start doing colonoscopy. Now, colonoscopy is not perfect. It only leads to a reduction of 80% in colon cancer incidence on the left side and 60% on the right side. So all of us can do a lot better in terms of preventing colon cancer with colonoscopy. And I'll focus my talk more on adenoma detection and resection. So what are the current screening guidelines? I think these are important to know, since a lot of you do colonoscopy, and at least some of it is possibly in the screening sort of paradigm. So you screen beginning at age 50 for an average risk patient. There is talk of getting this down to 45 just to address that epidemiologic fact that we are seeing of colon cancer in younger patients. And the aim really of colonoscopy is to decrease colorectal cancer incidence and mortality. And it is the criterion standard screening test. We won't have time to go through all the tests, but really I think if we put a patient through a colonoscopy, I think it's incumbent on us to do the best job that we can to decrease that risk of colon cancer incidence as best as we can, because it's very hard to get patients to do a colonoscopy, and when they do it, they really should be getting the most bang for their buck. So colonoscopy every 10 years is the criterion standard. What we're US